record on this computer. It is the second day of math class, so we're going to continue our lesson. Is there a book we can follow? For most of the beginning part, yes, your math book. The math, if you look on the schedule, I gave the chapters that each of them are out of. Mainly, honestly, the PowerPoint's your best bet for following along, Justinia, if that makes sense. That's why I try to distill it down for you a little bit. The statistics portion here, not really. This I added in specifically for PT. Does that make sense? Because you're going to have to read some studies and stuff like that, so I wanted to make sure you know it. All right, so it's second day of math. We're going to finish off the basics introduction lecture, and then we're going to get into the second lecture here, hopefully, as long as I'm not too long-winded. So who in here likes statistics? Does anyone like statistics in here? Isn't it so much fun? Statistics say that no one will like statistics. Yeah, exactly, right? Statistics are probably my least favorite. Now, look, I like conceptual math. I like theoretical math, and I don't like statistics. To me, statistics are not math. They're mean, especially when you get into doing different stuff in statistics. As far as statistics are going for this class, the definitions are what I'm going to require you. I'm not going to require you to do any statistics, okay? But understand what I'm looking at here, except for maybe mean and median. We'll talk about that. So statistics themselves is the study, collection, organization, analysis, and interpretation of data. And statistical analysis is like how we collect all that and then develop trends. In physical therapy, this is really important because this guides future treatment, right? If we do the statistics on a treatment for a total knee replacement and find out, well, patients aren't getting better with it, we can do the statistics on it and prove it's not getting the patient better and maybe pick a better treatment for that patient. That's the idea of statistics in PT. The basics of statistics, the mean, right? This is your average. And I always think about this because when you talk about mean in your school, if you don't do good on your class, your mean is mean to you, right? The mean is the average of all your stuff, right? So when you take classes with me, as you go through the program, you'll have more and more grades. Your average grade at the end of the semester will be the mean of all your grades, right? The median is the middle set of numbers. The mode is the most frequent number. So if I was to take a kind of a poll of the age of this class, I could take a mean and come out the average age of the class. I could take a median. What is the middle of the age rank? And sometimes those are the same, sometimes they're not, right? If we have a lot of younger or a lot of older folk, the mean is going to be skewed, whereas the median is going to be somewhere in the middle. And then the mode will tell me how many, like if we have 5 people that are 30 years old, that would be the mode because they would be the most popular number popping up. And then if we're the same thing talking about the age of the class, the range will be, I think our youngest in this class is 19, and I don't know what our oldest is. I'm going to say it's probably me, and that's like 78. That's what I feel like. And so the range would be the difference between those two, right? So if we have the lowest is 19 and the highest is 59, our range would be 40 years. That's useful in some settings. It's not as useful as the median and the mean, honestly, in statistics. But it does help us understand some things, especially when we're doing statistics and looking at specific treatments by age. If our range is really wide, if we're looking at from kids to adults, it's really hard to make statistically sound decisions on that because kids are different than adults, are different than older adults. So the higher level statistics analysis. So just so you know, you only have to know the definitions of these. I'm not going to give you an example where you pick out what they mean. So the alpha value. The alpha value in stats is the significance level. This is the probability of making a wrong decision, right? So this is telling you if my hypothesis is the moon is made of green cheese, the alpha value would be how much could I possibly be wrong, right? We don't obviously want that pretty low. If we're going to test a hypothesis, we need that kind of low so that we can know that we're actually testing for what we're testing for. The p-value is the significance of the results against your hypothesis. So the p-value would say, here are my results. Does my p-value relate to my hypothesis, right? Do my stats that I've got show that the moon is actually made of green cheese? If my stats only relate 10% back to the moon is made of green cheese, then my study is bad, right? And you'll see this quite frequently. I'm going to talk, one of the things I'll talk about when we go through these things, is one of the big trends in physical therapy right now is blood flow restriction. Has anyone heard of that before? BFR, or blood flow restriction. It's also really big in the weightlifting community, right? Blood flow restriction is literally like cutting off blood flow and doing a pump, right? It's interesting. If you look at the studies out there, there are tons of studies that show that blood flow restriction is fantastic for every age category. But there's almost no studies that show that blood flow restriction is bad. Well, that kind of concerns me, because even on some of the best exercises I can come up with, there are studies that show that that's not good for a certain age group or a certain category. So I think we need a little bit more research on BFR to see if it's a good thing, right? If, I'm just going to use Jimmy as an example here because he was the last one posted. If Jimmy is a 75-year-old male with blood clots, I'm probably not going to want to do blood flow restriction on him, because if I cut off his blood flow and I let his blood kind of sit and pool, he's going to develop blood clots. Not a good idea, right? Then I open up the blood flow again and the clot flies to his lungs and he has a pulmonary embolus. It's not good. We'll talk about BFR later. I'm not going to get into my whole skew on that. A standard deviation, right? Whenever you've seen this before, I'm sure that you've seen the good old bell curve, right? Everyone always saw that, right? So somewhere here is my median, which is my average score. And up here, we kind of break them into quadrants, right? Up here are the really smart people. Down here are the people that are not so smart. And then somewhere in here is where most of the people fall. As an instructor, your bell curve is important. In math, my bell curves are usually skewed to the higher end. So my bell curves are usually skewed to the 90 plus range, just because it's basic math. I'd expect that, right? But when we get into rehab, my bell curve is going to skew down into the 80s. The standard deviation would be if my median score is 85 and my highest score is 100, and say, here's the next kind of quadrant, here I'd have a standard deviation of 5 between each grouping. That's kind of what a standard deviation is. It's a range of variance. Whereas maybe the lowest score I got was a 60, my range then would be 40. So those are kind of what a standard deviation is. Again, just have to know the definition. You don't have to be able to describe it to me. You don't have to be able to draw a standard deviation or a bell curve. The sample size is the number of participants, right? If we have a study with 90 participants, the sample size is 90. But what do you think happens in studies? If they start off with 90, do you think they finish with 90 in the end in most physical therapy studies? What do you guys think? So say I'm doing a study today of, it doesn't happen, right, Sean? It just doesn't. Stephanie, same thing, right? We get drop off, especially if we're dealing with older adults. Unfortunately, have to deal with mortality, right? I did a part of a study where we were actually researching the effect of physical therapy on Parkinson's disease and doing aggressive physical therapy versus kind of passive physical therapy. Unfortunately, it was a longitudinal, so it was about a 2-year study. And by the time we got done with the 2-year study, we'd lost about 9% of our participants because they had passed away. That unfortunately happens, right? When we're dealing with human beings, unfortunately, these kind of things happen, right? Or the other thing is people get bored really easy, especially when we're doing something that's not rewarding them, right? So if I was today to give you a study and say, hey, I want you to come participate in this study, what kind of things could I do to make sure that you keep coming back to the study? What do you think we do? What could we do to make sure you keep coming back? Add some kind of reward, exactly. Yeah, right? Money is always a great reward. Yeah, gift cards are a great reward. For whatever reason, you know what we found is one of the best rewards, though, honestly? Food. For whatever reason, we can offer like gift cards to like Walmart or gift cards to Amazon, but for whatever reason, if we have food, people show up. So food is a great motivator, right? I just laughed. We did there was a cardiology company that was doing a study in Pennsylvania, and they wanted people to keep coming back. And the one day they bought them lunch and bought KFC. I'm like, okay, so not only are they giving them food, but they're kind of making sure that the people always have to keep coming back to the cardiologist, right? I'm just saying, it was kind of funny. Confidence interval. This is kind of a really important thing. This is the level at which you feel your values relate to one another. So confidence interval is how sure are you that you measured what you really needed to measure, right? So if I'm measuring range of motion on the knee, and my confidence interval is low, I didn't do a really good job of measuring range of motion on the knee. Do the definitions for the most part make sense? Again, that's really all you have to know for this class is the definitions. Okay. So I kind of went through the average, right? The average is the mean. You add all the individual units and measure up together, divide the sum, right? So if I have 5 grades, right? So if I have 5 grades, I have 100, I have a 90, I have 100, I have a 90, and I have 100. I'm going to add all of those up, right? So 1, 2, 300, 390, 480. Then I'm going to divide them by 5, and that will give me my average. That's how the mean works. The median itself is just what is the middle of it, right? So what's the literal middle of the data set? So you arrange everything in that case, right? So we had 90, 90, 100, 100, 100. In this case, when we line them up, the median in this case, in the middle is 100 for whatever reason. That's just the middle number of the order, right? If we had an even number, say we had an extra 100 in here, we would average the median of these two numbers together. But the median is just lining them up and figuring out what the number is in the middle. Count from one to right, count from left to right, and then come up with right from left and come up with the middle number. The mode is the most popular. They just did this. I don't know if any of you watched there was Eurovision Awards this weekend, and they ranked people as they were going through it. And the person that won the kind of VMA type thing that they were doing with Eurovision was the person who came up most in their searches. That was the mode, right? And the range is a set number and largest to smallest. I kind of covered that. So what you have to know is the definitions. So don't worry about doing the statistics of alpha value, p-value, standard deviation, anything like that. These are all important in physical therapy because of a large part of our practice is evidence-based practice, right? These words will come back to haunt you on your boards. And again, the good news is for your boards, you just have to know the definition. They're not going to give you a piece of research and expect you to be able to pull the p-value out of that research. So take a deep breath there, right? But they will expect you to kind of be able to define alpha and p-value because it's really, honestly, it's gotten more important than even since I went to school back when I wrote dinosaurs. Time. It's about time to talk about this. Boom. In physical therapy and allied health, which is what we're classified under, just to let you know, most of the time there's 2 different categories or 3 different categories when you're in the hospital. There's the doctors who are up here, right? There's the nurses who are here. And then there's allied health, who is pretty much everyone else, right? And funny joke about doctors, because one of my best friends is an orthopedic surgeon. Does anyone know what the difference between God and an orthopedic surgeon is? God doesn't think he's an orthopedic surgeon, whereas the orthopedic surgeon thinks he's God. I told him that joke once, and he's like, I should really be offended, but you're right. That's true. Dr. J. So no one laughed at that. I'm sad. I tried. Universal military time is used in most healthcare facilities, right? I grew up on this just because, my dad was Army Civil Corps of Engineers. My mom was ex-Navy. And so I grew up on military time. This didn't take a lot for me to convert to this. But for a lot of you, it may take some time. And the main reason is to stop the confusion over AM, PM. And Medicare does prefer this. So Medicare, usually when you're writing notes for Medicare, they want it in universal or military time. It's based on a 24-hour clock and avoids the AM PM confusion. So it begins at, O dark 100 or midnight where it's 0000 and goes to 11:59, which is 23:59. In universal time, colons are not used. So, in normal time, if it's 2:30, we put a colon and say PM, right? When military time, in order to convert that, if it's past 12 o'clock, we're going to add 12 to it. So 2:30 becomes 14:30. There is no suffix that follows it. We're not going to list AM or PM, and there is no colon in the time. Why am I saying that? Because I'm going to get some of you on a quiz question about that. I'm going to say, convert 1 p.m. to universal time. And I'm going to come down here and I'm going to go A, 1300 with a colon. And B will be 1300 without a colon. And everyone will come down here and go, oh, there's my answer. But it's got a colon. Colon wrong. Right? Colon is only in kind of this, what we call standard time or AM PM time. Right? So please don't get tricked that easy on it. Colons are not used and should be taken from it. So don't get tricked and choose an answer with a colon in universal time. So this is kind of looking at the standard clock. One of the things I'd recommend, if you can at this point, is convert your phone and your watch maybe over to 24-hour time so that you start getting used to it. Now, does this mean every facility uses this? No, it doesn't. But most do, especially if you're in the inpatient setting, whether at the hospital or at a skilled nursing facility. So be sure that you're aware of that. You will have a few questions where you do have to convert time. So 12 is both, midnight, right? Or 0000 or 2400. We don't use that very often anymore. It's more 0000. And then, 12 is also 12 o'clock if it's noon. So all hours should have 4 digits. Example, 1 a.m. or 1 a.m. is 0100. 10 a.m. or 10 a.m. 10 a.m. is 1000, right? So all of that. Anytime afternoon, like I said, you add 12 to that, and that gives you your time. So just be aware of that. That's kind of the way it's going to work. All my stuff that I will put on up for you, I usually list it as a military time or universal time when it's due, just so that you start getting used to it. If I say that it's due at midnight, right, that means it is due before the new day starts, right? So if it's due, at midnight on July 4th, right, that actually means you have till 23:59 on July 3rd to get it done. Now, normally I just list it at 23:59 to 59 to make sure it's easy for you. But if somebody says it's due at midnight, that means it's due technically the day before. Roman numerals. Oh, did the thing say 14? Or the sheet used to have that we added 12 and made it 1400. Don't write AM or PM. No, not at all, Stephanie. Just in this case here, right, where we have 2 p.m. Oh, let me get my little drawer up here. It went away. Where we have 2 p.m., it is just 1400. That is it. No AM or PM. Because we should know that if it's 14. Oh, yeah, that's fine. The sheet that you have from Dr. Reskin, maybe? Is that the one you're talking about? Or which sheet? Am I losing my brain? I don't know what sheet it was. But yes, just go off me. The one I just showed? Did I have one where it's PM? Oh, no. Oh, and the clock. Yeah. This is from the book. I'm going to have to send them another email. Thank you. That gives me something to email them. They like when I email them. Lately, it's just like, thank you for your notes. Please don't email us again. All right, Roman numerals. So this is what freaks everybody out. Oh my God, why do we have to use Roman numerals? The only thing you guys are going to have to know Roman numerals for is basically 1 through 10. And does anyone know why you might need to know Roman numerals 1 through 10 in physical therapy? Actually, technically to 12, but does anyone know what we use those for? Well, good news is what we have them for is these, the cranial nerves. You're going to have to learn these in anatomy, right? These will come into play. And we'll talk more about these in neuro rehab as well. But the cranial nerves are nerves that are up here in your head, basically, right? They come out of your brain. These are your kind of very first nerves that you have before you get a spinal cord. And these all do something in your body. But the cranial nerves, when they are written out, if you are writing them out on a sheet of paper, you're going to write CNV for cranial nerve 5, or CNIII for cranial nerve 3. Why is that? Well, because we also have cervical nerves that could be written C2. And that's in order to kind of differentiate those two. It'll make them a little bit more difficult to confuse. I think it's also because at some point, somebody way back in physical therapy world said, or in anatomy said, we're going to make this harder on purpose and going to make them have to remember 12 of the Roman numerals. So it is what it is. This is the most you really have to know for physical therapy for Roman numerals. So Dr. Johnson won't talk to you about this nerve. I will in neuro. It's actually a really new, interesting field that's coming up, the terminal nerve. I won't mention that one right now. We'll talk about that in neuro because I don't want to get you totally confused yet. It's a really cool theory right now. But as you're going down through, we've got cranial nerve 1, right? Cranial nerve 1 is the olfactory nerve. That's your nose, right? It's a sensory nerve. Optic. I don't know if I could see what that one would be for. That's for your eyes, right? That's a sensory nerve too. Oculo, meaning eye. Motor, meaning movement, is a motor nerve. Go figure, right? CN3. Trochlear. So trochlear means to pull to one side. So SM stands for sensory or motor. And again, this will hit a lot more in anatomy, but I'm just kind of giving you a preview now of it. Meaning, is the nerve receiving data, or is it making something move, or is it doing both? Like when we get down to the facial nerve or the trigeminal, it has a both sense and a motor component. So it allows things to move. So trochlear allows your eye to pull mainly towards the inside. And we'll cover that in anatomy a lot more. But trochlear is the way the nerve is shaped and the muscles it affects. It's a motor nerve. Then we got our trigeminal. And trigeminal we'll talk about quite a bit. I just touched my glasses, that really annoyed me. We'll talk a good bit about neuro because patients get what's called trigeminal neuralgia, right? Or nerve pain. And trigeminal neuralgia kind of follows a pattern like this on the face, where they'll say, I've got lightning coming like this in my face. That means the trigeminal nerve's inflamed and they've got some possibly infection. A lot of times they have a herpal infection of the trigeminal nerves. So it's got some sensory, it does some sensation, but it also moves certain muscles of your face. By far, my all-time favorite muscle of the cranial nerves is this one. Dr. Johnson's favorite is the vagus, but my favorite is the abducens because it reminds me of Street Fighter. Abducens! You'll never forget that one now. I promise you. That's cranial nerve 6. It says abducens. It abducts the eye, pulls the eye out to the outside. It's a motor nerve. Gee, can you guess where the facial nerve might go? What do you think? Does anyone have a clue? That one's a difficult one. Yeah, it goes to the face, right? It also has some motor components and has some sensory components, right? Facial nerve is one of the nerves that's responsible for helping you smile, which mine is broken. It also makes you frown and wrinkle your brow or look mean, right? So facial nerve helps with those. It's a sensory and motor nerve. My second favorite nerve of all time in the cranial nerves is vestibular cochlear, just because it's so long and people spell it so bad. Vestibulo meaning balance, cochlear meaning hearing. So the balance and hearing nerve. Glossopharyngeal. Does anyone know what glosso means? I know you haven't gotten far into your med term yet. Does anyone know what glosso means? Because you'll see glosso in two of the nerves. Tongue, exactly. Very good job, right? And pharyngeal means what? What's an easy way to break that one down? Throat, yeah. So glosso, tongue, and throat nerve. Pretty easy. The vagus nerve. This is kind of the one that goes everywhere. I remember this one because it vaguely goes everywhere. It's number 10. It has a little bit of sensory and a little bit of motor. It's responsible for a lot of your autonomic function of your lungs and your heart and stuff like that. Accessory nerve. I don't remember what accessory nerve does. I don't know. Accessory nerve is a motor nerve that helps you shrug your shoulders. Right? It helps with that bringing up the shoulders. And then hypoglossal. Hypo meaning, what's hypo mean? Did you guys start getting that yet? Below. Yeah, right? So hypoglossal, under the tongue. Right? When we give medications to certain patients, sometimes we will give them hypoglossal meds, meaning they'll put it under their tongue, right? A good one for that is nitroglycerin for patients that are having heart attacks, right? It's a hypoglossal med that will slip under their tongue and it melts. But for my class, you know, the main reason I teach this is just so that when you get to anatomy, you don't write cranial nerve 10 or cranial nerve 12, because that's actually wrong. It should be CNX. You can skip the dash if you want, but you have to have cranial nerve and then the Roman numeral. So you go to 12 and that's it. There's not a ton of Roman numerals in physical therapy. So take a deep breath there, but I do have to cover these. Now you guys will learn some really cool mnemonics for remembering these. Dr. Johnson has a couple. What you will find is there are very clean mnemonics and then there are bad mnemonics. And I'm just going to tell you from experience, most students remember the bad mnemonics more than the clean mnemonics. It just is. That's the way people remember things, right? I don't know why that is. I'm sure we could probably do a study on that and determine why that is. But there's a mnemonic for remembering the cranial nerves, and there's a mnemonic for remembering if they're sensory, motor, or if they're both. For those of you that probably have had kinesiology in previous courses, you know that there's a mnemonic for these. So that's all you have to know for Roman numerals is just those. So that's it for that lesson. That lesson wasn't too bad. Let me get the next one up. The next one's the fun one because the next is fractions, decimals, and stuff like that. And that's just a ton of fun. All right. Time we got? We got about 11:10, so we got a little bit of time to get almost the way through this. All right, so why do you think we group fractions and decimals together in a lesson? What do you think my logic was for this? Does anyone have an idea? Well, because technically fractions and decimals are the same thing. Yeah, they're the same, right? 1/10 is the same whether it's 0.1 or whether it's 1/10. So we'll talk about fractions, addition, subtraction, multiplication, division, decimals, addition, subtraction, multiplication, division, how to convert both ways. And the more important part for you guys is temperature conversions and standard measurements. Those come into play with fractions more than just fractions themselves. So fractions and decimals both represent a part to a whole relationship, right? One slice of a whole pizza, one sip of a cup of coffee, one step in a long walk, one vote in a critical election. Those are all fractions of a whole, right? Personally, to me, one slice of a pizza is just the pizza folded in half and just eating it that way. But what do I know? Maybe that's why I've got too much weight on my body. So a fraction is a number that has two components, a part and a whole, right? 1 minute is one part of the 60 minutes in a whole hour, or 1/60th. 4 ounces is part of 16 ounces in the whole pound, 4/16 or a quarter pound, right? You hear that a lot with McDonald's, quarter pounder. 3 hours is part of the whole 24-hour day, 3 out of 24, or about 1/8 of the day, right? When you're with me in this class, you're with me for about an hour and a half. So you're with me for about an hour and a half out of the whole 24-hour day. Some of you wish it was a lot less. Maybe some of you wish it was a lot more because math is just so exciting. I don't know. Sometimes we need to make sure we have enough dose of a medicine available to treat the patient, right? So the client needs 2 teaspoons or 10 milliliters each dose. This is where you have to be able to do fractions to know if you have enough medications for that patient. We won't be administering medications orally, like nurses may or like doctors may, but we will be administering medications transdermally through their skin. So you do have to still know medications. The fractions help create a visual to see the mixture and relationship as part, right? This way, understanding fractions is really useful for helpful. So in the fractions, right, we have a numerator denominator process, the part to the whole. So the top part is your numerator. The bottom part is your denominator, right? That's your whole part. In 1 out of 1/12, one part to every 12 whole parts, right? In this class, I think there are 26 students total once you guys are all together. Some of you have tested out of math or passed your math out. You'd be one student in a class of 26, right? What's funny is we can actually use these to relate back to not only statistics, but also to ratios and proportions, which we'll talk about later next week. A proper fraction means that the numerator is less than the denominator. A mixed number includes a whole number and a proper fraction. An improper fraction, the numerator is equal to or larger than the denominator, right? So in this case here, 3/7 is a proper fraction. 3 3/4 is a mixed number or a mixed fraction. An improper fraction would be in the case here where we have 17/12. The numerator is greater than the denominator. An improper fraction is just a written out or a larger version of a mixed number. When we have 17/12, it's the same as saying 1 5/12. This is just the improper fraction. This is the easier way to multiply and divide and add if we need to do that. So you do need to be able to kind of go through that. Equivalent fractions are fractions of equal value. They're not written the same, but they're equal in value. 8 out of 8 equals 16 out of 16 equals 32 out of 32, 64 out of 64 equals 1, right? 2/8 equals 4/16, 8/32, 16/64. Those are equivalent fractions, right? In the case of the bottom here, if we're dividing up a pizza, we can cut a pizza into 2 slices, right? Like we have here, we have 1 and 2. Or we can cut the pizza into equal parts of 8, right? 1, 2, yeah, that was good, Keith. 5, 6, 7, 8. If you eat 4 slices of this pizza, it's the same as eating half of the pizza, right? And pizza's just so good that who wouldn't want to eat half a pizza? Actually, some of you are going, that is disgusting, Mr. McKeever. I could never eat half of a pizza. And the others are going, only half? Fractions are easiest to deal with if we make the fraction the lowest possible fraction we can, right? And we reduce them. In the case here of 4/8, that's not reduced, right? Because we can actually divide 4 into 8 and make that 1/2. That makes math a lot easier. We've all reduced fractions, right? 3/9 reduces to 1/3. 5/10 reduces to 1/2. And 5/10 and 4/8 would be equivalent fractions because they're both 1/2. If it's reduced, you can't go any lower, right? You can't really put 3 into 7 at all. You can't put 1 into 2 at all. 12 over 13, you can't get all. 13 is my favorite number because it makes everyone else superstitious, right? So reduced fraction just means you can't lower it any further. Now, could you convert that fraction to a decimal and get rid of the fraction altogether? Absolutely. And if you would rather do, when you get a question about fractions, you'd rather convert it to a decimal and do your question that way, that's fine. Whatever helps you get the right answer in the long run is all that matters when you're doing this. I'm not looking for your process or the road to the solution, as they used to call it back when I was going to school. And I think they just made fun of that in a commercial on TV. That was one of the things I learned, is road to the solution. Did any of you ever remember that back in like elementary school? If they teach you that still? No? I'm dating myself now. They also had abacuses in my school, but that's beside the point. The road to the solution used to be the way that you would go about solving a problem. I don't care about the way you solve it, as long as you solve it and get the right answer. I'm not looking to check your work. I'm looking, are you able to get the right answer? Because that's more important in healthcare than how you get there. So here we have a problem. In a PTA class of 30 people, 13 students are male, 17 are female. If we want to write the relationship of the number of male students to the number of female students, we're going to convert them to fractions, right? In this case, we have 13 male, right? So 13 male over a total class of 30 size. Females, 17 over 30. So that helps you kind of identify this. This kind of also helps when we're doing stuff like making classes, looking at maybe how many of you guys have degrees or how many of you don't have degrees, or how many of you have done observation hours versus how many of you haven't. It helps us tell kind of an idea of what our class looks like. So we got a question down here about 500 capped medicine cups are used daily in a long-term facility, and 1,000 uncapped medicine cups are used daily at the same facility. What is the capped to uncapped reuse rate? So if we use 500 of them and 1,000 of those, we have 500 to 1,000, or 500 over 1,000, but we can reduce that to 5 over 10, or 1/2. So that means for every 1 capped medicine cup that's used, 2 uncapped medicine cups are used. For you guys, not so important, but for a director of rehab or a director of the facility, that's really important for ordering stock to make sure you always have enough stock on hand. TheraBand is something you'll find in physical therapy clinics we're constantly running out of. But if we can keep track of how much TheraBand is being used in the clinic, we can try to keep that in stock and not run it. I said an improper fraction has a larger numerator than denominator, right? It either uses mixed numbers or whole numbers. It's used for dividing those mixed numbers. So in this case, we have 16 over 8. 16 over 8 is actually 2, but that's an improper fraction because the numerator is greater than the denominator. 23 over 21, or in this case, 547 over 23. That's just way too much math. You're not ever going to get a question like that, just to let you know. I'm not going to give you one like that to reduce. If you get one to reduce, it'll be something like 12 over 24. Honest, I'm not trying to trick you. I'm going to make it as simple as possible. KISS. Keep it simple, silly. When you're looking at an improper fraction, if you reduce it, it's typically going to result in a mixed fraction. So you divide the denominator into the numerator, and you place the remainder over the divisor to form a fraction. In this case, we have 11 over 8. Right? So if we were to do the long division of this, right? So we have 8 dividing into 11. Well, 8 goes into 11 one time. And we have 3 left over. So we're going to take that 3 and bring it up here in the numerator. Keep that denominator. And so 11 over 8 is the same as 1 3/8. In the case of the one we have up here, where we have 23 over 21, do the same thing. 21, 23. 21 goes one time into 23. We'll have 2 left over, so that would be 1 and 2 21st. That's just making, this is, the mixed number is the more proper answer in a math question unless it's asking you for an improper fraction. I bring this up because some of you probably eventually are going to consider going on for your DPT. And one of the things you're going to have to take in order to go on for your DPT is the GRE, the graduate exam. And there will be questions about this on the graduate exam. I thought I was kind of joking when I took this, that convert this number to an improper fraction. Really? Really? How to do that? It's like basic math. But those questions do pop up on those exams, getting you into college. You guys remember your SATs way back when for some of you. There's a couple of those on there that as well, right? So mixed number is a whole number plus fraction, so 1 3/4. If you need to convert back to an improper fraction here, you're going to take this and multiply it times that and add it to that. So 1 times 4 is 4 plus 3 equals 7. So in that case, we have 7 over 4. Again, I'm going to tell you, if your calculator does it for you, great. Even your iPhone will do fractions for you if you put the calculator on the iPhone into scientific mode or mathematics mode. It won't do it basically, right? So you usually have to turn the phone horizontally in order to use it. Or you can use the Google calculator as well, which will do it for you. When you're adding fractions, anytime that you add a fraction, the first thing you have to do is make sure that you have a like denominator. You can't just add 1/8 plus 1/10 to get 1/18. That's not the way it works. That's wrong, right? You have to have a like denominator because that is the parts that you're looking at. So in this case here, we have 3/6 plus 2/6. You're adding those two parts together. So if we have a piece of pie here that is divided into 6 parts, so 1, 2, 3, 4, or should we give me 6? What you're saying is 2 of these plus these 3 equals how much of it? So 3 plus 2, you're going to keep when you're setting up, you're going to set them up horizontally. The denominator will always stay the same in addition and subtraction. And then the numerators are the only thing that's going to change. In this case, we're just going to add them together. 3 plus 2 is 5. So we'll end up with 5/6, or we'd end up with 5/6 of the pizza. I always relate it back to pizza. It must be time for lunch. What if your answer in the end is an improper fraction? Well, in this case down here, we have 4/8 plus 5/8. Our answer comes out to be 9/8. Well, if you do that in the proper answer form, unless it's asking, can you please provide your answer in the form of an improper fraction, then 9/8 is the right answer. If it's just asking you for the answer, you have to reduce it to a mixed number. So in this case, 9/8 is the same as saying 1 1/8, right? So that's dividing that pizza up into 8 slices. And you eat 4 of those slices, 4 slices. And then you eat 4 more plus a slice from another pizza. How much did you eat? We ate a whole pizza and 1/8 of another pizza. Am I making anybody hungry yet? Talking about pizza constantly? Just wait till we get to wound care and I ruin food for you. If we're adding numbers that have mixed numbers or mixed fractions, you add the whole number separately and then add the fraction separately. So in this case here, we have 14 2/8 plus 7 1/8. We're going to add the 14 and the 7 together to get 21. We're going to add our 2 fractions together to get 3/8. And the final answer will come out to be 21 3/8. This is why I don't like fractions, because to me, it's a lot easier to do this in the form of decimals than it is fractions. And when I was doing a lot of my math courses and stuff like that, I always tended to convert everything to decimals because it made more sense to me. But if you're asking for a fraction, you got to answer the question in a fraction form. Finding a common denominator, right? Sometimes we want to find this with our family, right? We want to find a common denominator. In my family, it's awful hard to find a common denominator because we live in two separate worlds. It's very rare that anything my family and I agree on. I'm actually going back to visit them next week, which will be loads of fun. Still be teaching you guys, but I get to go visit them for a week, which I'm looking forward to. I'm really looking forward to. I can't find common denominators with those people. But in order to add numbers together, we have to find a number that the denominators are the same on. So that's where we get those equivalent fractions. So here we have 2/3 plus 1/6. Well, we can't add those together and say, well, it's 3/9. Because 3/9 is really 1/3. And the real answer is 5/6. 1/3 is definitely not the same as 5/6. Right? So that's kind of important to realize that we can't do it that way. So what do we got to do? Well, we've got to go, okay, how can we get a common denominator here that makes these able to be added together? Well, 6 and 3, right? 3 goes into 6. Okay, that's good. We know that. We also know we can multiply 2 times 3 to get 6. If we multiply the bottom times 2, we have to multiply the top times 2. So 2/3 is the same as saying 4/6. Now we can add them together because we've got like denominators. And that's how we get that 5/6 number. Again, I'm going to tell you calculator is probably the easier way to go about it. But when you're in the field, a lot of times you're not going to be able to get this. And honestly, simple math is a dying art right now. I don't know if anyone's ever gone into a grocery store, or the other day I went into Walmart. It was about 2 or 3 months ago. Actually, no, it was a year ago now. Oh my God. I went into Walmart and the power was out. And they were having all the cashiers hand ring stuff up. They had like little handheld scanners. They could add everything up. And then they had to calculate change at the end. And that was just a nightmare. My bill was $23.98. I handed $25 and the person couldn't figure out what my change was. I'm like, just keep it. It's not worth it. Going out now. Right? Doing simple math like this is a lost art at this point. Difficult common denominators, one does not go into the other. Well, what you can do at that point is multiply each of them by each other. So in this case here, we have 3 plus 3/13 plus 1/4. Man, sitting here racking my brain, I have no idea what a common denominator is just looking at this, right? If I'm talking, 2/3 and 5/6, it's really easy. I can look at that and go, oh, well, I can just do that, convert that to 6 by multiplying that times 2 and multiplying that one times 2. And I can get, 4/6. That's easy. But over here, this gets difficult. Like, what? Wait, I don't know what to do here. So what you can just do is multiply these together and get a common denominator. So 4 times 13 is 52. So now your denominator commonly is going to be 52. And then you're just going to multiply the top times the same number that you multiply the bottom times. So in order to get 52 for 13, we multiplied it times 4. So we're going to multiply this times 4, right? And we'll get 12/52 up here. We multiplied this times 13, so we'll multiply this times 13, and we'll get 13 up here. So in the end, we'll add them together and get 25/52. Now, in that case, there's not a way to simplify that one. So that's going to be your answer. You answer that and move on. That is way more complex than any question I'm going to give you on your tests. Most of the questions you're going to get on quizzes for me would be something like 4/9 plus 1/3. Oh, well, that's easy. I know that 3 times 3 is 9. So that means I multiply that times 3. So that I know that 3/9 is equal to 1/3. Now I can add 4 plus 3 and get 7/9. I'm not going to try to make this very difficult for you. This is important for me to teach, but I don't feel this is really important direly to your physical therapy education. So I'm going to try to make it as simple as possible. I hope you all appreciate that, because that makes your life a little bit easier. Yeah, Stephanie's like, yeah, please, I hate fractions. It's okay, I agree. Comparing just requires using common denominators. If you want to look at which is more, 1/4 of a pizza or 3/8 of a pizza, you just have to come up with a common denominator. And that's just like what we did with adding and subtracting, right? Now I can look at this and go, oh, I know that 1/4 is less than 3/8 just because my brain works that way. But it doesn't always work that way for somebody, right? Like if I said which is greater, 3/9 or 1/3, I can look at that and go, you're trying to trick me, Mr. McKeever. That's a trick question. Why is that a trick question? See if anyone's awake here. Yeah, they're the same, right? This one reduces down to 1/3. That's when you go, samesies. There won't be an answer that says that, but they're equivalent, right? But when we're comparing fractions, we just have to convert them. Why is that? I've seen this before where, like for me, I worked in restaurants a long time ago in a land far, far away as general manager of a burger restaurant, not like fast food, but like a high-end burger joint. And I loved it when they would say, we have the 1/4 pound patty or we have the 10th pound patty. And customers would come in and go, so I'm just curious, which of those burgers is bigger? And I'd be like, really? Really? I can't help you here. And I say I can't, right? We know that the 1/4 pound burger is going to be bigger because 1/4 pound, right, would be saying here with 1/4, we'd have 10/40 versus 4/40. That's the bigger burger. And then people that are vegan are yelling at me right now for talking about burgers. I'm sorry. I always relate it back to food. I told you. When I was growing up, this was my meanness to my younger brother. I'd say, hey, I have a $50 for you. If you'll, look, I'm going to, or no, better yet, here. I'm going to give you 2 quarters. That was a mean brother. If you give me that $1 bill, just think about it. If you give me those 2 quarters, or I give you those 2 quarters, you get 2 things, and I'll only have 1 then. And my little brother's like, that sounds like a good idea. Cha-ching. Right? But 2 quarters is 50 cents. Like, I just took money from my little brother. I now feel guilty about that years later. Right? That's fractions. He didn't understand his fractions. I can't help him there. If he'd have done better in math, maybe he wouldn't have known that. How to subtract fractions? Well, we do the same thing. We create a common denominator if necessary, subtract the numerators, leave the denominator the same, and reduce as needed. Right? In this case, we have 7/8 minus 2/8. The denominator is going to stay the same the whole way across. Then we're going to subtract the 7 from the 2, and we'll get 5/8. If you subtract one fraction from another, your answer should always be a smaller fraction because you're subtracting. That's literally what subtraction means. Just saying. You get a bigger number out here if you're like, oh, 7 minus 2 and you get 9/8. You did something wrong. That's not right. You should always get a smaller answer when you're doing subtraction. In the second one, we have 3/9 minus 2/9 leaves us with 1/9. If we get a mixed fraction like we have in the case here, the best idea is, again, subtract the two whole numbers, and then subtract your fractions. That way you can get your answer easier. You can set them up vertically. You can do them separately. I've seen people that'll go, well, 25 minus 20 equals 5. And then I'll do 3/4 minus 1/4 equals 2/4. 2/4 is equal to 1/2. So my answer is 5 1/2. Again, I'm not looking for what road to the solution you took. I'm looking, did you get to your destination? And your final destination is always getting the answer. That makes things a little bit easy for you. Oh, no, that's not what I want to do. Close that real quick. All right, so let's go back over here. Here, drawings. All right. So multiplying fractions. Multiplying is different than addition and subtraction. When you multiply fractions, you are going to set the problem up horizontally and multiply straight across. So you're going to multiply numerator against numerator and denominator against denominator. So here we have 7/8 times 1/4. We're going to set it up, and we are going to multiply 7 times 1, which is 7. We're going to multiply 8 times 4, which is 32, right? So our answer would be 7/32. When you're multiplying fractions, typically you will end up with a smaller fraction in the end, typically, unless you have mixed numbers. Sometimes that can mess things up. When you multiply fractions times a whole number, well, a whole number is nothing more than the number over 1. So if you have 1/6 times 2, it's basically the same as saying 1/6 times 2 over 1. When you multiply them out, you get 2/6. You reduce it, and it gets to 1/3. With mixed numbers, the first thing you have to do, if I have a 5 1/4, is I have to convert that to an improper fraction. So I take 5 times 4, and then add that 1 back in. So 5 times 4 is 20, plus 1 is 21/4. Now I have 21/4 times 1/3. Right? So then I'm going to end up out here multiplying it out, right? And that makes it, just coming through, cleans it out, makes it easy for you. You can also cross multiply here, which is what this is talking about down here. I know that 3 in this denominator goes into 21. 3 goes into 21 7 times. Oh, not 2. That was not good. My cursor slipped. Sorry. Goes into it 7 times. That makes it a little bit easier for me, right? So I can cross multiply that way. Doesn't really matter how you do it again. When I look at these, I'm usually going to go through and do my decimals because that's the way my brain works. But if you do the decimals, you have to convert back to a fraction in the end, which can get a little difficult in the end. Common math sense. Any number over itself equals 1. So 8 over 8 is 1. 128 over 128 is 1. 14 over 14 is 1. 36 over 36 is 1. Any numerator with a denominator that is 1 is a whole number. So 4 over 1 is 4. 6 over 1 is 6. 102 over 1 is 102. Any number or any whole number can become a fraction by just placing a 1 as the denominator. Those are just some common fraction sense here. And that will help when we do multiplication and division. Division is where things get a little bit more complicated, and this is where most people, and this is the last thing we're going to talk about today. Division is where people get kind of hinkied up and get messed up. Division is nothing more than performing multiplication of the reciprocal. Reciprocal means the inverse. 2/3, the reciprocal would be 3 seconds. 22 35ths, the reciprocal is 35 22nds. It simply inverts the numerator and the denominator. So in the case here where I have 1/2 at the bottom here, divided by 1/4, we are going to flip this, and that will flip this sign to a multiplication. So it will become 1/2 times 4/1. We'll get 4/2, otherwise known as 2, which is what the answer we have down here. So when you're doing division, you're going to flip this and change it to multiplication. So if we do something like 2/3 divided by 1/2, we're going to do this. We're going to flip the 1 and the 2, and we're going to flip the sign, change it to a multiplication. So this really is saying 2/3 times 2/1. So we're going to multiply those together, 4/3, or 1 1/3. So division is the one that gets people caught up the most. Again, this is probably about as difficult a problem as you're going to get. You're not going to get something like 412/355 divided by 1631/97. I'm not going to make anything that difficult. That's a lot of math and requires brain. And that's just too much brain for a math class like this. So you're not going to get something that difficult. You'll get something pretty simple like these questions over here. You might get something that's like 7/8 divided by 2/8. Well, we know that we're going to flip them. That means we're going to flip that sign to a multiplication. So what we really have is 7/8 times 8/2, right? Oh, look, I can cancel those out. So I get 7/2, right? Or 3.5. So I'm going to try to make this as simple as possible for you guys. How do decimals, or how does this come into play? Well, again, this is what we're going to talk about on the next class that kind of breaks down where we get fractions and decimals together, is when we're looking at medicine labels. Because medicine labels, how many in here actually can admit that medicine labels aren't the easiest to read? Is anyone going to admit that? I mean, they're not the easiest to read. How many of you just take whatever the medication the doc tells you to take and just go with it? That pretty much everyone does, right? Yeah. But it's kind of nice, and I hope that by the time we're done, you'll understand how that medicine is broken down, meaning what's in it, what part to what part. This is one of my favorite ones we'll talk about here. We'll talk about some Vicodin next class, and how much our patients love Vicodin. So I'm going to stop sharing here. Are there any questions for today? Again, so today we started with just kind of finishing off with statistics. We went over Roman numerals and military time. Again, with statistics, you just have to know the definitions. With Roman numerals, you just have to be able to know 1 through 12 so that you can get the cranial nerves right. Right? And military time or universal time is basically what we're going to use in the clinic from now on. And when you fill out your timesheets for Dr. Ovreskin, which you will have to do, you will have to do them in universal time. And then we started on fractions, dealing with adding, subtracting, multiplying, dividing. Pretty simple. I'm trying to break this down as simple, like chicky break it down. Did I lose anybody yet, or is everyone still awake? Did anyone fall asleep on me? Oh, if you fell asleep, then you're probably not going to answer anyway. Right? Just saying.